You're watching CTOM TV. Knowledge is power.
Another case example was Maryanne, and this is a woman that called us. She had fairly advanced disease. She had actually been on the Keynote 189 protocol, and so she wanted to know if it was the best for her. And she had actually been on it before she contacted us. It's a combination of pembrolizumab, pemetrexed, and platinum-based drug. So there's a bit of a mistake there, Michelle. She was actually on it when she called us, and she wanted to know if it was the best thing. So we confirmed that it was the best thing for her. And this is kind of a unique case because typically when somebody calls us up and says, am I on the best thing? And we do tumor DNA sequencing, we will often find out that, hey, maybe that's not the best thing. But in this particular case, the doctor did have her on the best thing based on her sequencing and so on. So the doctor had decided that since some of her tumors were growing and she was having some complications, that he didn't think that she was responding. She had some other symptoms, although it was during COVID. She was coughing, and he thought that the drug had stopped working. And so it looked like her tumors had increased in size. We suspected pseudoprogression. We wanted to rule it out. So we knew that she had this KRAS G12D mutation. And so we're able to measure the amount of that mutation in her blood. And we found that it was incredibly low. So we provided this information to the oncologist and said, hey, we believe this patient has pseudoprogression, because normally if she does have progression, she would have a very high amount of her KRAS G12D mutation. And we see hardly any. So we believe the patient's still responding. And as a consequence, she was.
Thank you for watching CTOM TV. Subscribe below and stay informed.